Hello again, everyone. My name is Marty Guthmiller, and I am CEO of Orange City Area Health System. Welcome to today's COVID-19 Community Briefing, 13th edition. One of the things that I'll start out with today, and today's going to be a little briefer than maybe other sessions, but I wanted to give you just a couple things today. First, again, a scoreboard. No change from yesterday. Still 68 tests, 3 positive, 65 negative, and no pending tests right now. Just an observation at this point from my perspective as well. I think we're entering a very vulnerable time as we begin to open things up. Social distancing measures are still extremely important as we transition to the new normal, as we say. And just my observation of activity that I see around town, I think people are sick of it and people want to kind of get back to normal. The governor's proclamation yesterday seemed to indicate a number of things. We'll talk about that briefly in just a moment. But I think it's really important to keep our discipline at this point. Another thing that I wanted to update you today is on the COVID-19 hospitalizations by county. Pretty good news here. I just listed a number of counties in our area to include Sioux, Lyon, Osceola, Cherokee, Plymouth, O'Brien, Dickinson, and Clay. All of those counties that I just mentioned have 0 COVID-19 patients hospitalized at this time. And so that's good news. What's not so good news is the fact that Woodbury County in Sioux City has 32 hospitalizations with COVID-19 diagnosis. So good news, things are still quiet on the Western Front largely. And again, Sioux, Lyon, Osceola, Cherokee, Plymouth, O'Brien, Dickinson, and Clay all have 0. I want to talk a little bit about the governor's proclamation yesterday, and I'm not going to get into whether your church should meet on Sunday or not. Those are other discussions, and I have an opinion on that, but I'm going to let that go for now. I do want to emphasize, though, that the proclamation yesterday did continue us to require the rather stringent social distancing measures, social isolation measures in our senior care facilities. And so those will continue as they currently are with masking, goggles, keeping 6 feet away when visiting, those types of things. And so that will continue. And quite frankly, from my perspective, will continue for a while yet. I want to remind patients also who are visiting the health system or accompanying a patient to the health system here in our physical facilities to try to bring a mask along with you if you have one. That'll simply keep our supplies stocked. And so we'd appreciate you bringing a mask along if you have one. Don't worry about it if you don't. We'll provide that, but it will help us out. Also, look for more information coming very soon on beginning elective cases. I talked about that a little more extensively yesterday. I'll probably be talking about it more tomorrow. We're going to have things in place that is going to open up a lot of our surgeries, a lot of our elective procedures, and so stay tuned for that information. It's coming. So that's going to be it for today. Thank you again for joining us. Remember to stay vigilant, stay strong, and stay healthy. Thanks again for joining us.